everyone, so we're going to be looking at the heart and the great vessels, and we're going to be seeing how they appear on different imaging modalities, so CT, MRI, ultrasound. We'll also look at the great vessels, so the aorta, the pulmonaries, and see how they appear on different imaging modalities as well. So we're going to do a quick refresher just to remind you of the sort of gross anatomy of the heart. So we did cover this last year in your respective anatomy modules, but I think it's a good place to start just to have a reminder of the different chambers of the heart and all that kind of thing. So we'll have a little refresher. Okay, so the heart basically is a component of the cardiovascular system, which is made up of the heart, the vessels and the blood. And you'll probably remember from last year, it sits within the mediastinum, which is sitting within the thoracic cavity. And in there you have your heart, you have your aorta, but you also have the trachea, the esophagus, and lots of other things as well, like lymph nodes. But for the purpose of today, let's just focus on the heart, and we'll focus on the great vessels. A little reminder of the functions. So we need our cells and our tissues need oxygen to survive, and that's what the heart is doing. It's pumping oxygenated blood around the body and also giving us nutrients like proteins and vitamins and hormones as well. And then it's also part of removing waste, so we don't want carbon dioxide, so it kind of takes that away as well. And each part of the heart serves a different function. So we'll focus on the heart for a second and forget about the great vessels for a wee moment. So we have the 4 chambers of the heart, and you'll probably remember this from last year, but I just want to remind you of what they are. Okay, so you'll see that you've got your 4 chambers. So you have the right atrium, the right ventricle, the left atrium and the left ventricle. Okay, and then you've got your 4 valves. So between your right atrium and right ventricle you've got the tricuspid valve, and then between the left atrium and the left ventricle you've got the mitral valve, which is sometimes known as the bicuspid valve. And then running up the middle between these, I don't know if you can see my little pointer here, let's see if it works. Running up the middle between the 2 ventricles you have your ventricular septum, and then between the 2 atrium you have the atrial septum. Okay, so that's the main body of the heart, and the left and the right side have different functions. So the right side receives low oxygenated blood, so it's lacking in oxygen, and it receives it from the upper body and the lower body, and then it pumps it through the right ventricle, the right atrium to the right ventricle and into the lungs so it can get oxygenated. Okay, and then it comes back into the left side of the heart through the left atrium, and then it gets pumped through the body. Okay, so to help the heart work, you need to include the great vessels. Alright, so this is a continuous process when you talk about blood flow through the body and blood flow through the heart. If it's not continually happening, then there's something wrong. So I think in first year I said to think about it like your pipes at home or in your bathroom. The water is constantly flowing, alright? So the blood is constantly flowing, but for talking's sake, we'll say that we're starting with the superior vena cava and the inferior vena cava. So the superior vena cava is receiving blood that is low in oxygen from the upper part of the body, and the inferior vena cava is receiving blood that's low in oxygen from the lower part of the body. Alright, and then it's going into the right atrium by means of the inferior and superior vena cava. And then as it goes into the right atrium, the valve contracts, okay, and then it goes into the right ventricle, and then it passes through the pulmonary valve into the pulmonary trunk, and then it goes to the pulmonary arteries, so it goes to the left and the right hand side, and then when it's in the pulmonary arteries, it then goes into the lungs and it gets oxygenated, alright, and then it comes back through by way of the pulmonary veins and goes into the left atrium, okay. Once it's in the left atrium, it passes through the mitral valve into the left ventricle, then through the aortic valve into the aorta, and then the aorta delivers it, to the rest of the body. So whether it's to the subclavian arteries, or right down through the descending aorta into, say, the iliacs, which are down in the pelvis. So that is basically the flow of blood through the heart, and just that little reminder of the chambers and the reminder of the vessels should help you as we go through this presentation. So reminder of what we're going to be talking about in terms of anatomy. We're going to be focusing mainly on the 4 chambers, which are made up of the right atrium, the left atrium, the right ventricle and the left ventricle. In terms of vessels, we're going to be focusing on the pulmonaries. So this is the pulmonary trunk, and then coming off the trunk, you have the left and the right pulmonary arteries. We're going to be focusing on the aorta, so the ascending, the aortic arch, and the descending aorta. So that's going to be the main vessels that we focus on when we're looking at these images today. Okay. Right, so let's get started. So we're going to look at imaging of the thorax, the heart and the great vessels. We're going to start with normal appearance, and then we will look at some abnormal appearances and pathologies towards the end. So there's many reasons why we would image your thorax, your heart, your great vessels. It might be that clinicians are concerned that a patient has a blockage in their pulmonary arteries or in their aorta, or the patient might have had chemotherapy, radiotherapy, or cancer treatments such as Herceptin that can damage the heart muscle. They might be concerned about an aortic dissection, as what happens when injury to the innermost layer of the aorta means that blood then flows between the layers of the aortic wall, forcing the layers to come apart. They might be concerned about a child having congenital heart disease, which is just a term for a range of different birth defects that affect the way the heart works. For example, a baby could be born with a ventricular septal defect, which is a hole in the ventricular septum. So remember that line that was running through the ventricles that I pointed out in the first couple of slides? That means that sometimes you can have a hole between the 2 ventricles, which means obviously there's an issue with blood pumping through. Okay, you can also get a hole through the atrial septal defect. So you think about the line running between the ventricles, the line running between the atrium, and usually that's nice and full. And in the case of this congenital heart disease that we're discussing just now, you can get a hole, which means that there's an issue with blood flow passing through. Other reasons why you might image the heart is if there's any suspicion of coronary heart disease, which is just stenosis, so a blockage of the blood supply going through the coronaries, which are the arteries that actually provide the heart with blood. Or you could be concerned about cardiomyopathy. Okay, so there's lots of different things that you'll be referred for imaging of the heart for. And sometimes that's not the reason why you've been sent for a scan. It might be that they find something incidental when they're maybe doing a cardiac CT, a thorax CT for another reason, and then they see something on the heart. So moving on to the next slide. The first thing we're going to look at is just the basic x-ray, okay? So it's not the most exciting thing to look at when you're looking at the heart, but it does give us some information to go on, which is why, we do assess the heart when we're looking at chest x-ray. So the top image obviously is pointing out the lungs. Oh, I think you'll be aware of that by now. And then it's also pointing out the heart shadow, okay? So this is known as the cardiac silhouette, and it refers to the outline of the heart seen on an x-ray, okay? So it's really just referring to this white area that we know is the heart, all right? The size and the shape of the heart and its appearance on a chest x-ray can give some clues for underlying disease, alright? So on a chest x-ray, from the frontal position, which is what we're looking at here, the cardiac silhouette can be split into the right border, which is here, where you can see the right atrium, okay? And you can also see the superior vena cava coming up here. And then you can see the pulmonary trunk and the pulmonary arteries. This one's going into the right lung and this one is going into the left lung. Alright. You can also see the inferior vena cava running up here as well. Okay, so it does actually give us some information and you can see outlines of vessels. This one gives us a bit more of a detailed diagram of what part of the heart is where on a chest x-ray. So you can see obviously on the sort of left hand side towards the apex of the heart you have the left ventricle, then you have the left atrium, and then up here you can again see the aortic arch, which you can also see in this one here, but it's maybe a bit more obvious here. This is the aortic arch sitting in here. And then you've got the right atrium and the right ventricles. Alright, so as I say, this will maybe if the heart looks large, that might be concerning that there's an underlying pathology. So chest x-rays are useful for assessment and can give clues that there might be something more sinister going on. However, for more detailed information about the heart or about an underlying pathology, we then look to cross-sectional imaging to give us that information. So the first thing I'm going to start with is a CT scan. Alright, so when we are scanning the thorax in CT, it includes images of the heart. Now there are specialist CT heart scans that can be done that are very kind of specific. I'm not going to go into that today because that's not something that you need to know. What you need to know is what does the heart look like on an axial, sagittal and coronal image from CT. Okay, so we will look at different images in different planes, and there is definitely anatomy that I would expect you to be able to identify once you've done this lecture and studied and looked at the images. So on the left here you can see this is what's known as a scout image, so it's like a planning image for CT. It does look like a bit of a rubbish chest x-ray, which I suppose it kind of is. It's a kind of low dose image. And we just use that in CT. I say we, I haven't done CT in quite a while, but we use it in CT for planning our thorax. So this box basically is the field of view or the slices that we want to include, and we're basically including from the apices and just past the diaphragm, okay? And you can see the patient has their arms above their head because they don't want to irradiate the arms unnecessarily. Okay, so there's different levels where you can see different parts of the anatomy, because obviously we're scanning, all these slices that are like slices of bread, so you're kind of cutting through the body at different intervals. But I've focused on the level of thoracic vertebra number 6, and the reason I've done that is because it gives you a really good view of the sort of the beginning of the heart. So if you think about the heart almost starting with the at the top where you can see the ascending aorta, that's why I've identified this slice. So they're both the same slice, and this one on the right obviously just shows the anatomy. So what you can see is we're at the level of T6, and you can see in the front here that you've got the sternum, okay, so your breastbone. And then what you can see is at this level you've got this big chunky area, which is your pulmonary trunk, okay? And off your pulmonary trunk, we know that you have the pulmonary arteries, all right? So we need to know what's right and what's left. And I know you've been doing this module for a little while, so apologies if you already sort of understand that. But the way I always remember it is as if you're looking at a chest x-ray. It's the same, so it's the opposite to what you're looking at. So this is the right-hand side, and this is the left-hand side. And anytime I get kind of confused about that, because it definitely did happen, I would always imagine that I was the patient lying on the bed, and what would be my left and what would be my right. So if you're looking at this just now getting confused, literally imagine yourself turning around, lying on the bed, okay, and we are seeing the patient as they're lying. So that would be the left and that would be the right, okay, because the patient is lying on the bed and we're looking at them from the feet up, okay, and we're looking at them as they are. So we are turning the image. You might already know this, I'm probably just harping on about it and you already are aware. Okay, so starting again, you've got your pulmonary trunk sitting here, and you've got your pulmonary arteries going into the lungs, delivering that blood that we want to get oxygenated when it's in the lungs. All right. We've also got the aortic, the ascending aorta sitting here. We've got the superior vena cava just sitting to the right of that. And then we have the descending aorta sitting here, okay? Now it is the same vessel, don't get confused and think we have two vessels that are called aorta. It's still the same artery, it's just that when you're catching it, because it curves, so you're seeing it at one part of the curve, you're seeing it at the ascending part of the curve, and then you're also catching it at the descending part as well, alright? And that's because it goes in an arch. What else have I haven't missed? So that's as mentioned basically all the important for this lecture anatomy that you can see. Now obviously there's other anatomy on here. You've got breast tissue, you've got ribs, you've got scapula, you've got lungs and pleura, but for the purpose of this lecture I only want you to focus on the anatomy that I have labelled on these images. Okay, so we'll move on to the next slide that I've identified. So this is us getting into the main body of the heart. So you'll notice the last one was at thoracic vertebra 6. This one's at thoracic vertebra 8. Okay, so we're getting into the sort of meaty part of the heart, the chunky part. And now we can see the 4 chambers. So the atrium and the atria and the ventricles. So you can see here, this is the right hand side. So this is the right hand side of the heart, which in this part is the right ventricles, because the ventricles are closest to the apex, which is this bottom part of the heart here. Okay, so this is the right ventricle, the right atrium, the left atrium, and the left ventricle. All right, now you can also see, because we're starting to move down the heart, that the descending aorta is still there. All right, we can't see the ascending aorta anymore because we've passed that, but because the descending aorta is going right down, we catch that as well, and it looks like a nice little circle. Okay, and you can actually just see off the left atrium the right pulmonary vein just sitting there. And remember, the pulmonary veins are what take the blood that has just been oxygenated in the lungs. The pulmonary veins are the ones that then take it back into the heart, so into the left atrium, so it can go into the left ventricle, so it can go into the aorta. Alright, so that's why you can see that just coming off the left atrium there. Okay, it's just sort of hiding behind. So again, this is the sort of thing that I would want you to be able to label and identify the 4 chambers, okay? Again, there is other anatomy on there, vertebra, you know, all that kind of thing, but just focus on the heart for this purpose. Okay, so before was an axial view, so an axial CT. Now we're looking at the sagittal view. And I've chosen to do the midline slice. So basically we're working through our body laterally from left to right or right to left. And I've chosen to give the midline slice, which shows the heart. Okay, so there's lots of information on here, but again, focus on the stuff that I have labelled. Just move myself out the way a little bit. So you can see the sternum is sitting at the front there. Get my pointer back. So yeah, so the sternum is sitting just here. So it's bright white because it's bone. Okay. And then the other anatomy that you can see, not really a cardiac anatomy, but you can actually see the liver just sitting under here. Not necessarily cardiac, but good to be able to spot it. And this is a really, really good image to show you the aorta in all its glory. So you can see here that you've got the ascending aorta, this kind of bit here, and then it becomes the aortic arch because the arch is round. Okay, and then it becomes the descending aorta because it starts to go down into the thorax, and then it becomes the thoracic aorta down here. Okay, so it's a lovely big curve and you're able to follow it all the way down. As well as that, we can still see some of the four chambers. So we can see the left atrium just sitting in here. We can see the right atrium, and we can see the right ventricle. Okay, now the heart is a tricky one because the kind of axis of the heart doesn't really align with the axis of the body. It kind of sits, remember, angled, almost like an ice cream cone in the chest. So that's why you can see the left atrium and the right atrium just sitting like that, and then the right ventricle there, but you can't see the left ventricle, and that's because it's not completely straight. You're not going to get this perfect slice all the way through to see it all in profile, unless you do some angles like we do in MRI. Okay, but don't worry about that just now. Just make sure you can identify the different bits of anatomy I've highlighted here. Okay, so this is a coronal view of a CT thorax, and it's quite a nice one to look at the right atrium and left ventricle, as well as the ascending aorta. Alright, so you can see on here, this is the right hand side of the chest, and you can see this is the right atrium, and then you can see the left ventricle with the ascending aorta going into the arch of the aorta. Okay, and you can also see the pulmonary trunk just sitting posterior to that as well. Okay, so this is a slice that's just a little bit anterior to the midline of the chest, so a little bit forward to the midline of the chest. Okay, so I've chosen these different slices because these are the ones that probably you can see the heart in the most profile. But obviously there's lots of other slices that you can go through and see different aspects of the heart. So just be aware that these are only select slices. Another thing that happens in CT is a pulmonary angiogram to look at basically the blood flow going through the pulmonary arteries. So I want to just show you that for a wee second. Okay, so that's just loading up. So the CT pulmonary angiogram is usually performed to exclude any pulmonary embolism, and lots of different departments might have different methods, but basically what they want is adequate enhancement of the pulmonary trunk and the pulmonary arteries. So you can see them on this slide here. Now what they do is they basically scan the patient and they give something called contrast, which highlights the vessels, and then you can see the vessels highlight on the scan. So I'll just scroll through this image. Hopefully it will work. So you can see here that there is, I'll get to the very top of it first of all. Okay, so this is us working from our neck down. I'll just move myself out of the way. So if you move down, you can see that you're coming into the heart here, okay? And all of a sudden you can see this bright, this is when the contrast is coming into the heart. This is the pulmonary trunk, okay? This is the right pulmonary artery and the left pulmonary artery. And you can see as you go down that that contrast goes into the lungs, and it's looking for any pulmonary embolisms, okay, of which there is none on this patient. This is a normal heart and a normal pulmonary artery, and you can actually see that it's sitting in the chambers of the heart as well, the contrast. Okay, and then we go down to the liver. So that's the kind of thing that we'll do in the CT. I'm not going to expect you to know about that in great detail, but what maybe I would expect you to know is that one of the reasons why you would do a CT angiogram would be to check for pulmonary embolism. Okay, so again, you could maybe see on an image, this is a contrast-enhanced pulmonary trunk and a contrast-enhanced pulmonary artery right and left. Just pop up the presentation, just 1 second. Okay, so that's us looked at the heart on CT in a little bit of detail. Now I want to go to MRI. So it is much more complex, as are most things with MRI. You know, it's something that takes a long time to learn how to do. It's a really interesting thing to do, one of my favourite things to do, but it is complicated, okay? But what I'm going to say to you is please don't get anxious about it, because I'm going to make it much more simple for you, because I'm going to not ask you to identify things like T1, T2, FAT-SAT. All I want you to think about when it comes to cardiac MRI is dark blood and bright blood, okay? Specifically bright blood, that's what we'll be focusing on today. Now, that's not because I don't think that T1, T2 and FAT-SAT are important, it's just in cardiac MRI, it's not something that we are focusing on for the purpose of this lecture, alright? So just think about bright blood images. I'm also going to ask you to forget about axial, sagittal and coronal, which I know is a bit tricky because that is what we tend to talk about in cross-sectional imaging. But in cardiac MRI, we only really do axial, sagittal and coronal to plan our images, and then we move on to much more specific views. So what we kind of tend to name the views are based on what we can see. So there's so many different views that we do to look at lots of different things, but I'm just going to focus on 3 today that give us some good information. We're going to be looking at a 4-chamber view, a 2-chamber view and a short axis view, just for the purpose of this lecture. Okay, so the first one we're going to look at is the 4-chamber MRI of the heart. So this is a really good image that you'll probably have seen in first year when we did the heart anatomy lecture, but it's a really good image to get your head around because it shows the ventricles really well, it shows the valves, and it just gives you a kind of good understanding of the gross anatomy of the heart. So the reason why we would carry out this particular sequence or this particular view would really just be looking at the overall function of the heart. So how are the ventricles working, how are the valves working, looking at the atrium, the atrial on both sides, and also to evaluate the myocardium, so that muscle of the heart that we've talked about. So you can see on this image here, I'll see if the wee pointer works. Hopefully it's working there. If not, you'll see, obviously it's labelled anyway. So on the right hand side, you can see that you've got your right ventricle, and then you've got your right atrium, and then you've got your tricuspid valve, just this little kind of line here. And then on the left hand side, you've got your left atrium, your left ventricle, and your mitral valve, just sitting in here. Now, a really good way to tell which side is which, if you didn't have any labels, is that your right ventricle will have a thinner myocardium and your left ventricle has a much thicker myocardium. So you can see around the left ventricle here, it's darker. So this black outline is heart muscle, is myocardium, and it's thicker on the left hand side. And the reason for that is because your myocardium is working harder on the left hand side. So the heart muscle is working harder because it's having to pump, you know, the blood that's been oxygenated around the body. Okay, so it's working harder. It's just like if you're going to the gym and you're working out your muscles, the harder you work, the bigger they get. So that's why you can always tell the left hand side should have on a typical heart a thicker myocardium around it. Okay, so familiarise yourself with this image. Make sure you can identify the right ventricle, the right atrium, the tricuspid valve, left atrium, left ventricle, the mitral valve, and then also the myocardium coming around in the black outline. Cine, so it's almost like a little mini movie. So you remember cine sounds like cinema, so it's kind of like a small movie. And it's basically lots of slices put together and played kind of back and forth to give us this movie. And it's really, really good for, looking at the left and right function and then measuring, say, like the ejection fraction, which is basically a measurement of how much blood the left ventricle is pumping out with each contraction. Okay, so you can see here these little valves opening, shutting. When they open, the blood goes through. All right, and then the same on the left-hand side, opening, shutting. It's actually really cool. You can actually just see them opening and shutting all the time while the heart is contracting. So it gives a lot of information. And then some very smart radiologists will go away and do some calculations to calculate the ejection fraction. So the next view we're going to look at for the heart is the the two-chamber left side. Now you can do a two-chamber right side and a two-chamber left side. I've focused on the left side because it gives us a lot of information about that really hard working side of the heart. Okay, so what it gives us is a view of the left atrium, which is just up here, and the left ventricle. Okay, now I want you to ignore this green arrow. It was just on the image that I have for this side of the heart, so you don't need to know what this is. Just ignore it. Okay, so you only need to think about the left atrium, the left ventricle, and we know that the mitral valve sits in between these two chambers, and you can actually see it on there. Okay, you can see the mitral valve. It's like a kind of faint dark line. You've got your myocardium sitting around. Now we know it's the left side because it's thick and it's dark. Okay, and then you can actually also see the pulmonary vein going into the left atrium as well. All right, so this view is used to assess the arterial and ventricular left side walls and also the function of the mitral valve. The last view we're going to look at for MRI is the short axis view. So basically we do slices through the heart from the base to the apex. So if we think about our heart being almost the shape of an ice cream cone, the base is the top of the cone and the apex is the pointy bit of the cone. Okay, so we are slicing through the heart to give us this short axis view. And the short axis view allows us to assess the thickening of the ventricular wall and the myocardium, okay, and also the volume of the ventricles as well. And it gives us both ventricles in the same picture. So it gives us the left ventricle and the right ventricle. And the left ventricle is this lovely circular shape. The right ventricle is not as pretty, okay? It's a bit of like a burst bag or something. So that's a good way to remember if you're having to identify this, say on an exam or something like that. The left ventricle tends to be, on the short axis view, a nice circular shape, and the right ventricle is a bit like a bag that's deflated. Okay? You can also see the myocardium, as I said, and it's nice and dark, and it's like a dark ring around the left ventricle. And you can still see the myocardium on the right ventricle as well, but it's definitely not as thick. Okay, so you might be glad to know that that is the MRI part of the heart done. We're going to move on to some ultrasound now. So specifically cardiac ultrasound, which really is better known as echocardiography. It is actually the most widely used cardiac investigation. It gives really good comprehensive information about the heart, the great vessels, the valves, the size of the chambers, how they're functioning. And really it is very essential in the management and diagnosis of lots of patients who might have some sort of cardiac disease, or they're suspicious that they might have a cardiac event. So as I said, we look at the valves and the function, and there is lots of different views that you can do, but for the purpose of this we will focus on 4-chamber, which sounds familiar, so it's similar to the MRI, and short axis, again similar to MRI. So if you look on the 4-chamber echocardiogram, you can actually see the MRI that we've just shown you. It's maybe slightly turned, But again, it's giving you really good information and the same information as the MRI. So you have the right side of the heart with the right ventricle and right atrium, the left atrium, left ventricle, the apex, so the pointy part of our ice cream cone. This would be the base. And then you can see the valves as well, okay? And you can see the septum, so the intra-atrial septum in between the two atria, and the intraventricular septum as well. Okay, so this is the short axis of the echocardiogram, and similarly to the MRI, you can see both the left ventricle and right ventricle in the same profile. Okay, basically comparing both, not comparing, but looking at both the 4-chamber and the short axis echocardiogram, you'll notice that the atrium and ventricles are hypoechoic, meaning that they are low in signal, and that's because they're filled with blood. But you'll also notice that the myocardium and the septum and valves, they're much more hyperechoic, meaning they give more signal, they give more echoes, therefore they are more dense and they give more signal in the scan, okay? So things that are hypo, so H-Y-P-O, they are darker looking, they're giving off less echoes, so the ventricles, the atrium. But things that are hyper, so H-Y-P-E-R, they are giving off more echoes, okay? So that's just something to remember if you were to maybe describe the 4 chambers of the heart on an echocardiogram. You would say that the 4 chambers are hypoechoic, but the valves, the septum, the myocardium are hyperechoic. Okay, so that has looked at the heart in 4 different imaging modalities. We looked at it on a chest x-ray, we looked at it on CT, we looked at it on MRI, and we looked at it on ultrasound. The next part of the lecture will look at some pathologies, and we'll look at it on different imaging modalities. Okay, so I'll leave you for now, and then you can watch the next part of this when you're ready.